There are three types of blood vessels in your body: arteries, which carry oxygen-rich blood from your heart to your body; capillaries, where the nutrient and oxygenated rich blood is exchanged for used blood; and veins, which complete the circle by carrying the used blood back to the heart. While the heart creates the pressure needed to send blood through the arteries, one-way valves are in place in the veins to promote the heartward flow of the blood. If these valves malfunction, your veins can become engorged with blood and appear to twist and swell from the surface of the skin, particularly in the legs and feet. This painful condition, called varicose veins, is extremely common, especially in women. Leg swelling, itching, burning, aching, and small branching spider veins often accompany this vascular condition. Heredity is the #1 cause of varicose and spider veins. However, pregnancy, extended standing, obesity, and aging can contribute. Veins that are painful or unattractive can be treated with measures ranging from compression stockings to light source laser treatment and surgical removal. You may elect to have abdominoplasty or a tummy tuck if you have excess fatty tissue in the abdomen that does not respond well to exercise, loose or sagging abdominal skin, or abdominal muscles that have been weakened by pregnancy. During abdominoplasty, a long horizontal incision is made from hip to hip just above the pubic area, and for complete abdominoplasty, another incision is made around the navel to free it from the surrounding skin. The skin of the abdomen is lifted up from the abdominal wall, either up to the navel or all the way up to the ribs, and the excess fat is then removed. Stretched or weakened abdominal muscles are tightened and secured with sutures, and excess skin is removed. Finally, the remaining abdominal skin is stretched back down over the abdomen, and the incision is stitched closed. And in the case of complete abdominoplasty, a new hole is created for the navel. Swelling, bruising, and pain are normal following abdominoplasty, but will lessen within a few weeks. You may also experience numbness that can last up to several months. The skin is the largest organ in our body. It not only protects our internal organs, but it also regulates our body fluids and temperature. The skin is made of 3 layers. The epidermis is the outer layer of the skin that contains squamous and basal cells and melanocytes, the pigment that allows your skin to tan and protects the deeper layers of the skin from the sun. The dermis, which contains blood vessels, connective tissue, hair follicles, and sweat glands; and the subcutaneous, the deepest layer of the skin, which contains fat cells and collagen. Skin cancer can occur when there is an uncontrollable growth of abnormal cells in a layer of the skin. There are 3 common forms of skin cancer that are distinguished by the types of cells affected. Basal cell carcinomas do not typically spread, but require treatment. Squamous cell carcinomas can spread and can be life-threatening if not treated. Abnormal cells that invade the melanocytes, called malignant melanoma, is the most severe form of skin cancer. It can spread quickly to other parts of the body through the bloodstream and the lymphatic system, and can be fatal if not detected and treated. The genital areas of mature men and women are often covered by thatches of coarse pubic hair. These hairs may become infested with a small insect called pubic lice or crabs through sexual contact or sharing clothing or bedding with an infested individual. Pubic lice are generally tan in color and are about the size of the head of a pin. They are relatively flat, and when seen on the skin, they often look like small scabs. The lice have claws on each side that helps them attach to the pubic hairs, where they lay their eggs. The eggs, called nits, look like small brown dots attached firmly to the base of the hairs near the skin. Adult lice feed on human blood by inserting their mouthpieces into small blood vessels in your skin. While the lice are feeding on your blood, proteins in their saliva are transferred into the skin. After you have been infested for several days, or if you have previously been infested, these proteins are recognized by antibodies on the surface of special immune cells. When the saliva proteins bind to the surface antibodies, the immune cells release chemicals that cause itching and inflammation. Fortunately, pubic lice can be treated with over-the-counter medications. Your skin is the largest organ of your body. It serves many important functions, including protection, as well as temperature and fluid regulation. Despite its resiliency, your skin can be damaged by hormonal changes, exposure to environmental elements, and aging. If the appearance and texture of your skin have been affected by these factors, you may elect to have a 15 to 20 minute 3-step procedure called a micropeel. During the first step of the micropeel process, either physical scraping or an enzyme solution is used to remove dead skin cells and other debris from the surface of the skin. Next, a 15 to 30% glycolic or lactic acid solution is applied to the skin and left on for about 15 seconds to 2 minutes. This solution helps to further clean the skin and remove debris that is lodged in the pores. Finally, the skin is treated with cryogenic therapy, in which a carbon dioxide dry ice ball is moved over the skin in even circular motions. The ice ball freezes a micro-thin layer of cells off of the surface of the skin. A micropeel will generally improve the overall look and feel of your skin, evening out the color and texture, and softening fine lines and wrinkles. However, several treatments may be needed to achieve the desired results. Your skin is the largest organ in your body. It serves many important functions, including protection, as well as temperature and fluid regulation. Despite its resiliency, skin can be damaged by hormonal changes, exposure to environmental elements, and aging. If the appearance and texture of your skin have been affected by these factors, you may wish to have a procedure called microdermabrasion. During microdermabrasion treatments, which generally last about an hour, a jet of very tiny crystals is sprayed across the surface of the skin to remove impurities and imperfections. The used crystals and debris are simultaneously vacuumed into a receptacle and later disposed. Because microdermabrasion allows the controlled removal of the outermost layers of the skin, there is little pain involved and improvements can be seen immediately. However, several treatments may be needed to achieve the desired results. If you are at a suitable weight but have localized areas of fat that do not respond to dieting or exercise and cause certain areas of the body to appear disproportionate, you may choose to have a procedure called liposuction. During liposuction, very small incisions, approximately a 1/4 inch in length, are made in the problematic area, and a hollow tube called a cannula is inserted into the fatty tissue. Often the cannula emits ultrasonic waves to break up the fat cells. The ultrasound device in effect liquefies the fat, allowing a larger amount to be removed. During the procedure, a doctor will guide the cannula, moving it around under the skin, while an attached vacuum unit suctions away the liquefied fat. Although liposuction is effective and can be performed on several areas of the body at the same time, it should never be thought of as a substitute for weight loss through diet and exercise. Your skin is composed of many layers of tissue. The outside layer of our skin is called the epidermis, and the next layer beneath that is called the dermis. Our skin relies on water and a fiber called elastin to maintain its resiliency. Natural aging, hormone changes, and exposing your skin to too much UV radiation can cause dehydration. Dehydration reduces the amount of elastin in the dermis and causes it to lose its flexibility. The result is unwanted wrinkles and saggy skin. Laser skin resurfacing removes damaged tissue using beams of light that vaporize skin cells. Tissue is destroyed and removed, exposing healthy underlying epidermal tissue. The result is natural-looking skin. The growth cycle of normal hair lasts 2 to 5 years and consists of 3 phases. The anagen phase is the first and longest lasting stage where hair is actively growing. The catagen phase lasts only a few weeks and the hair root is moving toward the scalp. The telogen phase is a resting period that ends when the hair falls out and the anagen phase starts again. The growth cycle is in different stages for every hair, which is why many people have a full head of hair. Male pattern baldness is a result of a shortened growing phase, so hair is coming in at a faster rate, but it's not growing to the length it did before and does not last as long in the scalp. Most male pattern baldness begins at the temple and crown of the head. Hair loss can be hereditary, but other causes could be related to stress, excess UV radiation, drug side effects, high fever, or hormone changes. The growth exposure to freezing temperatures can cause frostbite to occur in the tissues of the extremities, especially the hands and the feet. The first stage of frostbite, called frostnip, begins when the skin turns white and soft to the touch. With further exposure, ice crystals form in the skin cells, progressing to deeper layers. Next, superficial blood vessels freeze, decreasing blood flow to the affected area. The lack of blood supply and icy temperatures then begin to affect the underlying muscles, tendons, vessels, nerves, and even bone. The extent of permanent tissue damage will be determined by the amount of time the tissues remain frozen. If you think you have experienced frostbite, warm the skin slowly in lukewarm water. Do not use hot water or dry heat to warm the area, as this may worsen the damage. A surgical procedure called a facelift or a rhytidectomy can be used to reduce sagging cheeks, deep folds running from the corner of the nose to the corner of the mouth, jowls or sagging skin at the jawline, and loose, flabby tissue around the chin and neck. During a facelift, an incision is generally made in the natural contour of your ear, extending around the earlobe and back into the hairline. The skin is then freed from the underlying tissues. Once the skin has been lifted, excess skin and fat are removed, and deeper tissues may be tightened or repositioned. If necessary, further incisions can be made to remove fat and restructure the underlying tissues of the neck, eyelids, and brow line. After a brief period of swelling and bruising subsides, hairstyles and makeup can be used to conceal the surgical scars. Our eyelids protect our eyes from foreign objects and help us maintain eye moisture. However, the effects of aging, exposure to environmental factors, and genetic predisposition can decrease the aesthetic appearance of our eyes and interfere with vision. An eye lift is a surgical procedure that can reduce some of these common problems. The tiny incisions needed for an eye lift are hidden within the natural crease of the upper eyelid and just under the lashes on the lower lid, or sometimes inside the lower lid itself. Through these incisions, fat, and if necessary, excess skin is removed. Then, the skin is drawn together and the incisions are closed. Following the procedure, the eyes are left with a more alert and youthful appearance. Eczema is a common skin disorder. The word eczema is a general term that refers to an inflammation of the skin that produces an area of itching and redness that may even blister, weep, peel, or flake. Like asthma and hay fever, eczema is considered an allergic illness, although it can also be activated by emotional stress. An eczema flare-up occurs when the skin is exposed to an irritant or allergen. Special cells involved in the body's immune system recognize the allergen and release chemicals that cause the itching and redness. Further damage occurs when the affected area is scratched. In order to lessen the frequency and severity of flare-ups, the skin should be kept moist and well protected from irritants and allergens. Everyone has a certain amount of fat. However, sometimes we have localized areas of excess fat that do not respond well to dieting or exercise and cause parts of the body to appear disproportionate. Liposuction, a fat removal technique, can be performed on many areas of the body, including the chin. During submental or chin liposuction, very small incisions, approximately 1/4 inch in length, are made under the chin and a hollow tube called a cannula is inserted into the fatty tissue. The liposuction cannula is connected to a vacuum unit, and a doctor will move the cannula under the skin while the vacuum suctions away the excess fat from the chin and neck. In younger patients with more elastic skin, this procedure can sometimes replace a surgical facelift. Chickenpox is caused by the varicella zoster virus. The virus is highly contagious and is spread by coming in contact with infected droplets from a cough or sneeze or touching open sores of a person with chickenpox. Most often, symptoms of chickenpox begin with an itchy rash that can spread over your entire body, including the inside of your mouth, around the eyes, and on the genitals. The rash begins as red spots, but will form fluid-filled blisters that will drain and eventually scab over. The rash usually lasts for 7 to 10 days. In 1995, the Food and Drug Administration approved a chickenpox vaccine. It is recommended that children be immunized after the child is 1 year old. Our skin is the largest organ in our body. Exposure to extreme heat, radiation, electrical shock, or chemical agents can cause our skin to burn, causing pain, blistering, and sometimes irreversible damage. The epidermis is the outermost layer of the skin. The dermis is the middle layer, and the subcutaneous tissue layer is the deepest layer of the skin. Burns are classified as first, second, or third degree burns, depending on the amount and depth of tissue damage. A first degree burn causes damage to the epidermis, and you may feel pain, redness, and some swelling. Typically, this type of burn will heal without scarring. A second degree burn causes damage to the epidermis and the dermis, and usually results in pain, redness, and blistering. Third degree burns are the most severe because damage extends past the upper layers of the skin to the sensitive subcutaneous tissue, destroying nerves, blood vessels, and other dermal components. Extensive third-degree burns can be fatal because the threat of infection is extremely high. In fact, bacterial infection is the leading cause of death in burn victims. In your foot, the bones, tendons, and ligaments located at the base of the great toe, called the medial first metatarsal phalangeal joint, work together to distribute your body weight. A bunion is an enlargement of the bone or tissue surrounding the medial first metatarsal phalangeal joint. It is a common foot deformity that can be inherited, or it can occur as a result of repeated stress to the joint. The enlarged bone or tissue pushes the big toe inward, sometimes under the other toes, causing a protrusion on the outside of the foot. Bunions can also occur on the fifth metatarsal joint or near the pinky toe, called a tailor's bunion. Bunions can range in size and severity. Severe bunions may need to be surgically removed. Most people, however, find relief from wearing soft, pliable shoes and arch supports, and from applying ice to the sore toe joint. Our skin is a fairly resilient and elastic tissue. However, aging, stress, and environmental factors can take their toll over time. A surgical procedure called a brow lift can help correct sagging eyebrows as well as furrowed lines between the eyebrows and across the forehead. During a brow lift, an incision is made in the hairline, and the skin of the forehead and brow is freed from the underlying tissues. While the skin is lifted, fat and excess skin are removed, and the muscles of the forehead are then released. Following the surgery, the incisions are generally hidden in the hairline, and the face is left with a more youthful appearance. Your skin contains many tiny hair follicles or pores. Each pore contains a hair and a multi-lobed gland called a sebaceous gland. Sebaceous glands produce an oily substance called sebum, which normally travels up the pore to lubricate your hair and skin. Acne develops when a pore becomes clogged with excess sebum and dead skin cells. If the pore is clogged but the pathway to the skin surface remains open, the dark surface of the dried sebum is called a blackhead. However, if the pathway to the skin surface is blocked, the pore becomes infected and inflamed, resulting in a red, swollen, pus-filled bump called a pimple. Deeper and more serious infections may result in hard nodules called cysts under the skin surface. People of any age can experience acne, and most do at some point in their lives. Frequently, acne occurs during puberty and in conjunction with a woman's menstrual cycle due to an increase in the production of hormones called androgens, which can cause sebaceous glands to enlarge and produce excess sebum. Acne can be most often managed simply by washing with a mild soap and using an over-the-counter medication. However, if the acne is consistently large and painful or has produced scars, treatment by a physician may be necessary.